Good evening, or good afternoon, or good morning, depends on where you are in the world. Welcome to HDC Chat Speaking Series. And today we have the honor and the privilege to have Dr. Lina Bouayad with us today. Thank you, Dr. Bouayad.
Hello, everyone. Hi, Rashida, and hi to all your audience, everybody from wherever you are.
Wonderful. Before I read the bio, let me just again welcome you. And you're the first Moroccan that I have on this podium, and I'm beyond delighted to have you. And thank you for agreeing to be on the HDC Chat Speaking Series again. So,
Wonderful. My pleasure.
Wonderful. Dr. Lina Bouayad brings a powerful combination of academic rigor, real world impact through her work in AI and digital health. And I'm going to try to read from my piece of paper because her bio is so long and so impressive. And I'm going to try my best to shorten it, but I'll provide the full bio through the link. So Dr. Lina Bouayad, she is the co-founder and CEO and leads Top Health AI, developing AI-powered tools that provide second opinions and clinical clarity for complex health conditions like cancer and chronic pain. In academia and research, she's a leader and an associate professor at FIU. She directs the MBA in AI, has published in top journals. This is really important for those in academia, and secured over $5 million in research funding and speak at major conferences, to name few, such as AMIA and ICIS. Her personal mission as a cancer survivor, Dr. Bouayad blends her lived experience with scientific expertise to design human-centered AI solutions that empower patients and improve healthcare access. This is, again, an extremely short bio that does not give full credit to everything you're doing. And through this podcast and chat speaking series, we'll try to dive in a little bit who you are, what you do, and how you support the conversions of AI in healthcare, again, to support patients and providers. So thanks again. And I'm stuttering because I'm so impressed with everything you do that I'm trying to find the words together. So thank you again for being here today.
Oh, thank you so much, Dr. Parks. Thank you. It means a lot coming from you. Thank you so much.
Appreciate it. So a first question is going back to your background in academia. You worked in academia, you worked as an entrepreneur, startups, and also was able to get great federally funded research. What inspired your journey into healthcare and AI?
Absolutely. So you may think that my journey would have started in a lab or maybe in a course, but it actually started in the ER. So as I was experiencing pain and going through different ERs, and I was misdiagnosed 3 times. That's when I started to look at the healthcare system. And every time I was at the doctor's office, at a clinic, during my chemo, I was looking and researching. I was taking notes at how we can improve healthcare because I didn't want any patient to go through what I had to go through.
Thank you for sharing a personal experience. It's a lot of, I won't say gut, but it's a lot of care to be able to share that with other people. When I start looking at your startup, or I'm not going to call it a startup, but it is an initiative, and I'll let you talk more about it. But I looked at it, it's a bold concept when you say AI-powered second opinions. What does it mean for everybody, including myself? And what was the aha moment that led you to founding the Top Health AI business or company?
Absolutely. So as you may know, I'm not a medical doctor. So we're both PhDs. We're in the AI space, the information system space, but not medical doctors. So if I were a medical doctor, I would try to get more care and then see more patients. The issue is Specialists in the US, with all the good intentions, with all the goodwill to help patients, they can't, because we are short staffed and it's very difficult to see everyone. I don't know if you know the statistics, but to be able to see a cardiologist in Tampa Bay area, it takes 2 months. A GI is 3 months. A neurologist is 4 weeks at least. So you can imagine somebody going from one ER to the other, and not getting any diagnosis. And that's something else that I learned through the system. So originally from Morocco, like Dr. Parks, and she mentioned, when I came here to this country, I didn't understand the healthcare system. So when I had my stomach aches, when I started getting my symptoms, I went to a primary care provider. The primary care provider said, there's no care that I can provide. You have to go see a specialist. I said, okay, I completely understand. I need to go see a specialist. I started calling specialists, GI specialists, one after the other, and no one was taking new patients. So that was very, very frustrating. It took months to even get to be seen as a new patient. And then I got an upper endoscopy, and that was clear, but my symptoms were getting worse and worse and worse. And it was very difficult to get access to the specialist. So what do? We go to the ER. And again, I didn't understand that in the ER, I'm not going to get a diagnosis. The ER in this country is meant to keep you alive. So this
That's
is
right.
to our patients. So if you get symptoms, you go to the ER. Their job is not to diagnose you. Their job is not to cure the disease. Their job is to keep you alive and okay until you get to see a specialist. But I didn't understand that. I didn't have that information and I didn't have that knowledge at the time. So I kept just going to the ER, one visit after the other. I was sent home with opioids and told again and again to go see a specialist that I cannot access. With all the irony of things, my dad is a GI in Morocco. I called my dad, and by the third time, he said, Lina, you go back to the ER and you demand a colonoscopy. So there is no more waiting for a specialist. You have to go back and you tell them that you're not leaving until you get a colonoscopy. And that's what I did. But by that time, when I got diagnosed, it was already a stage 3 cancer. So,
Sorry.
yeah.
Scary. Yeah.
Yeah. So, with that experience, I wanted to provide a better experience for our patients and also for people who don't have a doctor in the family to tell them what to do. If it weren't for my dad, I would have been dead by now. So that's why we built this platform. This platform is meant to connect patients with severe cases with specialists within 48 to 72 hours. Now, to be able to do that or to provide that service within 48 to 72 hours, there's a lot that needs to get into place. So the first thing we do is we need to make sure that that patient is a severe case. Because if we start accepting all patients, then we're going to have the exact same problem that we have in the brick and mortar healthcare system. We're not going to be able to see everyone. So the first thing we had to build is a triage. So it's an AI triage. Once we get the information, the AI first needs to consolidate all of the data, because by the time patients come to see us, chances are they have seen several doctors. So they went to several ERs. So the first step is to consolidate all of that data. So we use AI and we use Neo4j and GraphDB to create one consolidated record from all those fragmented records. Then we have an AI to triage. Is this case urgent and severe that is worth our physician's time? And if it is, then we allow the patients to make a connection with one of our providers, and they get to get a telehealth visit. So the provider would get that clinical summary before they get to see the patients, which simplifies the process and expedites the process as well. Again, we are all about trying to get into that 48 to 72-hour window. So they get to see that summarized case all in a graph format. And then from there, instead of looking at all the record. They can just go dig exactly where they want to look at and only look at the records, that the parts of the record that they need. And they get to talk to the patient, advise them, give them recommendation, and the patients would get to either follow up with them at their office as a VIP patient. So we have agreement with all of our providers. If they get seen on our platform, because they have been triaged all throughout, once they get seen on our platform, they get treated as VIP in the office. So they get to see that specialist right away. And that is what we are trying to build. But then again, it's having a lot of different components and pieces of the puzzle in place to be able to provide that second opinion and provide it in time.
This is amazing because one of the major shortcomings of any healthcare system, including the one in the US, is the silo system. We have data everywhere. You went to the ER, you went to the GI, you went to the heart doctor, but they're not talking to each other as if they were speaking different languages.
Absolutely.
And it seems your platform is allowing those silos to talk to each other and provide a holistic view to the patients. Is that what you're?
Absolutely. Then this is one of the major things we are proud of, is that the ability to combine all of the records together, which is very, very important. So before I started this, and years after my diagnosis, I took all of my records and I just plugged them into ChatGPT. So those were records from the 3 visits that I had at the ER. And then I asked ChatGPT to give me a list of differential diagnoses. So just, what do you think this is? It was number 2 or 3 was colon cancer.
Wow.
So that was a punch in that was triggered the fact that I told myself, this is it. This is the problem. My doctors were not seeing the entire picture. When I used to go to the ER, I would talk to the triage nurse. The triage nurse did not necessarily relay all of that information to the doctor. I lost 20 pounds within 2 weeks. I could not keep food down. I could not function. I could not work. I could not sleep. All of that did not get relayed appropriately to the doctor. So by the time I saw the medical doctor, the emergency doctor was looking at me. I'm not crying. I'm not in that much pain. To them, I'm a healthy young woman sitting there with stomach aches. So nothing major. And also, to give them credit, at the time, the average age for colon cancer was 50 and above. So that's when patients are now required to have a colonoscopy. It's because that's when most people would get diagnosed with colon cancer. And to my understanding, that age is going down every year. That is because colon cancer is getting more and more prevalent among youngster adults.
Your explanation, this HDC chat series focuses on the convergence of AI in healthcare, and you giving us a really rundown to something personal, how it touches every single human at the micro level. And this is what I'm loving about this conversation. I didn't even dare to ask you to go personal, but you are, as a form of awareness. I'm going to move to something I did not think about asking, but we know from our data scientist training that every single AI system, for it to be efficient and successful, start with data.
Right.
If you don't have data, you cannot even get into anything. How do your patients collect or have access or bring together all the data they need for your platform, for Top Health AI, to be able to help them diagnose or at least review their severe case that they're dealing with?
So as of right now, we get the data in PDF format or as recorded by the patient. So patients go into their patient portals, download the data, provide the data to us. Now we're also working on integrating with the major EHR systems, where the Epic and the Cerner and Athena Health. So if we're able to do that, it'll be a lot easier for the patients to provide that data. But as of right now, we are collecting the data through PDFs. We are also working with the international markets just because there's a lot of need there, as you may imagine. So people are not sure that their providers, even though they have access. So if you know, in Morocco or in other countries, it's a lot easier to get access to a specialist than here. Uh,
Right.
However, once you see the specialist, the patients are still not sure that the treatment that they are being recommended is up to date. Just because of the nature of healthcare in Morocco, the continuing education is not mandatory. So that is when the patients lack that trust in the fact that the doctors or the providers may not have the latest and brightest techniques available. So we get some of the international patients as well. And with those, again, it's more difficult to get connected to their systems because over there, it's not one vendor that's taking most of the market share, is mainly like homegrown EHRs that are available.
Thank you for that information. Actually, there's a lot more than homegrown, and we'll talk about that probably in another episode or maybe later
Oh,
on offline. I did my Fulbright in Morocco last year, and I got to know a lot of innovations that are happening in the what they call it numerization, which is digitization, as well as AI initiatives within healthcare in Morocco. But that's something on the side we'll talk about later.
of course.
You provided. Really great background into how AI, top AI Health is providing second opinions. Is there any way you can share other use cases where your platform made a difference for a particular patient or for the doctor to be able to provide support?
Yeah, absolutely. So one example that comes to mind, there was a patient who was here in the U.S. and she was experiencing severe back pain. She went again to several ERs, and she was sent back home with opioids and with painkillers. And she contacted us. She gave us all of her records from the visits, and it was mind-boggling. It was like 75 pages of records that we were able to look at, and using our AI and one of our pain specialists on the platform. After reviewing the records, the specialist figured out that the problem was not in her back, the problem was in her neck. It was a neurological issue, and she got to follow up, and now she's completely cured. That patient, when she contacted us, she was using a wheelchair. She could not even stand up. And today she's completely cured. These are the kind of stories that warm our hearts and make us keep going. As you may know, the life of startup is not easy by any means, but it's these stories that keep us motivated and keep us going.
That is great testimonial. And when you talk about startup, a startup with a passion, with a purpose, I think is worth any big, huge organization that's in there for other reasons than supporting people. So, absolutely, whatever all of you out there that are listening, think about when you or your loved one are looking into second opinions. And had I known about actually your business, I would have reached out to you last year. I had to take a trip all the way to Morocco and take all my records to get a second opinion. And I did not know about you. And I would have done that. It would have saved me, an international ticket and the stress and everything. So thank you for a great opportunity to all of us, whether we have the means or not, to be able to lessen our worries and create a hope into getting cured and feeling better. I'm going to switch gears to academia, and this is how I get the honor to know you through your great publications and rigorous publications in top journals. That's how we get to know wonderful, high achieving people in our field. Your publication in AI, analytics, and informatics. Now, because I'm switching to academia, what are some of the maybe just one most exciting findings in those research that you've done or still doing?
course. So I'll tell you a little backstory that nobody knows. So that way
Okay.
it's different than going back and reading the papers and getting the findings. So it's a finding, or it's a study that started completely unexpected. So we were working on a study that is now published at ISR, where we were developing an auditing algorithm for insurance companies. That algorithm used the sentinel effects, and the idea behind it is to reduce waste and abuse in healthcare. As you may know, waste and abuse in healthcare in the US accounts to trillions of dollars. So if we're able to reduce that number by just a fraction, it would help all of us taxpayers. Well, it would be a great advantage to all of us. So we were working, and we were in the initial phases of the study. We had the algorithm, we had a realistic simulation with all the providers in Florida. We were showing by numbers how many millions of dollars we would save if that algorithm was being used for audits. And amongst other things that were included in waste and abuse was prescription of expensive treatment alternatives. So those are providers that would prescribe brand medications when the generic would do. They would prescribe another MRI when the patient has a different has had an MRI 2 weeks ago. So it was about the prescription and prescribing very high or very expensive treatments. So as I stepped, and I was presenting that as at Cheetah. It's a wonderful health AI or health tech conference. I would recommend it to everyone. So as I stepped down from the stage, I got a lot of providers, medical doctors that came to me, and let's say they were not very happy about what they heard. But what I got from them is that physicians had no clue, no idea how much each procedure or each treatment costs. And that's what, yeah. So they had no ideas. They said, you are trying to audit us. We have no idea what the price is. So don't blame us if we don't have that information. So that's what sparked our an idea for our next study, which is now at MISQ. And we looked at providing the price information to the physician, and we recruited 160 providers that were including medical doctors, nurse practitioners, and PAs, to see if they would change the prescription. Now, what we added was time pressure. So we were able to simulate time pressure and observe these providers at work and see if they would change prescription. And the finding was, very interestingly, the doctors did change, or they did look at the price even under time pressure. The physician assistants and the nurse practitioners didn't. So it's the idea behind all of this is context really matters. So when we build tools, we have to really understand the context. We have to understand the operations. We have to understand the context, because building that tool is not enough. It will not get used in the practice. And again, so that's why we built a division in Top Health AI called Top Health AI Studio, where we work with clinicians and healthcare teams who have an idea to evaluate that idea that they have, and then get recommendations, and then build a pilot and evaluate it in real settings before they get to deploy it. Just because we understand that context is extremely important. So in the studio, we connect clinicians with engineers, and then we get them to work together to get the context and then match it with the technology to be able to develop these tools that would be beneficial for everyone.
You just read my mind about the next question, but I'm going to digress a bit. Um, and talk about your research. It seems you're doing both theoretical but research with impact, and there is no doubt that's why you're publishing at top journals. And for those that are not familiar with ISR and MISQ, those are top journal in our field with less than 5% acceptance rate. So only the creme of the creme that gets accepted in those top journals. So thank you for sharing those stories and some of the findings that are embedded in context, but also with great applicable impact rather than just here is a section in our paper and we're like, this is the, the applied side of our research. You really live up to it. You mentioned in your Top Health AI studio that you connect engineers, data scientists, you're both, and then as well as medical doctors, and have them work together to solve healthcare problems for a better well-being. How do you balance all those roles? And as a person in academia, data scientist, and also an entrepreneur consultant, sometimes it may be too many hats. But we were, on my perspective, we were a hat full time, but not all at one time. Do all these hats ever conflict, or they complement each other? And when do you wear one or the other?
Well, I love
I
that
know it's
question.
full loaded question.
No, that is actually a great question because one complements the other in a sense that as a researcher, I am trained to question, to validate, to iterate, and that helps my entrepreneurial world or entrepreneurial hat, and trying, especially with the studio, trying to resolve problems, and even with our telehealth platform, there's always something that comes up. There's always a little issue that we have to resolve and work on, or something that we can improve. So as we talk to patients, talk to providers, and there are a lot of things that we can sense and we start to be curious. Can we do this better? How can we improve? And also that's how actually the idea for the studio came up. It's the clinicians who were asking. So I would call the clinicians to join our platform to provide second opinions. And then they start talking about excellent ideas. So I had one neurologist say, my dementia patients need an app. Their caregivers cannot take care of them. And if you build this app and help the caregivers take care of their patients and their loved ones, that would be amazing. And we're like, okay, well, let's think about it. Let's see if there's traction. And again, over there, we built a model to evaluate traction, to look at NIH funding, to look at previous ventures, to look at previous tools, to see if that idea is actually worth pursuing or not. So we never pursue an idea that we don't believe is going to work based on data. So we do take the gut feeling, the intuition, of course, but we also, as scientists, we like to back up everything with data. There are certain those differences. So as a founder, we have to act fast. So in academia, it's more of the rigor.
Yes.
In entrepreneurship, it's the speed. You have to get that next item or that next solution or the next pilot out the door very, very fast. Not to say that we compromise on quality, but there is a sense of urgency, and that makes a big difference. And that is why we at the studio, we don't build the full-fledged solution. We build AI pilots because we don't want to compromise in quality. We know we want to develop fast, but we don't want to compromise on quality. And how do I juggle all of it? Well, unfortunately, by the end of the year, I'm going to have to leave academia to fully focus on
Oh,
startup. So At some point, you have to make that decision. It was extremely difficult decision to make. I love my home, FIU, our departments, our faculty members are absolutely fantastic. We have an amazing team of researchers who support healthcare and health AI. Also, our community as a whole, like Dr. Parks and then other researchers, we get to meet at conferences and help each other and support each other. So I called that community home for over a decade now, and it was very difficult for me to leave. But I believe that to be successful and to make this work, I would have to spend more time into it.
Well, definitely breaking news on the air. I've never been part of this. Yes,
Right.
it's double-edged. On one side, I'm sure FIU and everybody in the community does not want not to see you at these conferences, but you're still, from what I hear, just so far, you're still part of it. You're still contributing, probably less on the theoretical side, but more the impactful side where we all need, whether researchers or whether patient and individuals. So I'm sure we'll see you at all these conferences. And of course, Florida is just a hop away.
Yeah, absolutely. And actually, for our AI pilots, I just got a research team that applied, and then they want us to build an AI pilot for them, and also evaluate it on our platform because we have a real setup, a real platform, telehealth platform, real database. So they're running the experiments on our platform. So they're having real physician and then getting their data and they're evaluating their model on our platform, which is fantastic. It made me very happy to get that request, and we're making it work. So we're gonna have
And you should. Yeah,
our first
you should
research.
be.
Yeah.
So this is really a call to all my colleagues, whether medical doctors or healthcare executives. One of the missions of this podcast, that it is knowledge sharing. This is putting people like Dr. Lina Bouayad that are both at the intersection, literally, of what this podcast is about, conversions of AI in healthcare with impact. And all my colleagues and friends and network in that space where you're making decision, where you need to look into making a difference for those complex situations, just to augment. We never talk about replacing, to augment better care for our patient. Please reach out to Dr. Lina Bouayad, and I will have her contact in the podcast, and you can reach out to her directly. So thank you, Dr. Bouayad, for providing this resource. Again, that last year I would have jumped on it in a heartbeat, and now I'm so delighted that I have it handy, should there need be.
Absolutely. Thank you so much.
I'm going to move to another section, another question, but it is really closely related to what you just said. You talked about context, which we know is extremely rigorous in research. We're trained to build that curiosity, critical thinking, and focus on anything that makes that model provide the best solution for our patient or to solve the problem. But we cannot negate, we cannot ignore that there are biases, whether implicit or explicit, that comes with the data or come with our perceptions, the doctor's perceptions, or the notes that are given or written within those medical records. How do you handle, or what does fairness and ethics and trust, I'm going to put them all together, mean when you're building, and you can pick one or two, when you're building AI systems to solve these solutions? How do you include this fairness, these biases, and handling them, especially when, as you experience it firsthand, lives are at stake?
Absolutely. So as you may know, I also do a lot of work in research. I still do research, by the way. So even if
You
I'm
always will.
not fully leaving academia,
No, you can't.
so we're doing research on algorithmic fairness, and that has helped me a lot. The studies, it's a whole realm that we are working on right now is around systemic fairness. So what we are looking at is, and in the literature, if you look at algorithmic fairness or fairness in general, you'll look at fairness at the individual level. That is either individual provider, individual organizational, individual firm or decision maker. However, we need to make sure that the entire system is fair. And that's what we do. We are doing in research. We are looking at how to measure that systemic fairness instead of just the regular model fairness. And for our models, of course, we incorporate all of the tools that are available to us to be able to measure fairness, make sure that our models are fair. When we are using the triage, for example, our triage tool, we have to make sure that we're not biased against a specific group of people, which is not always easy. And that's why at this stage, we still have a human review it. So we don't let the AI make that final decision, just because we still don't have enough data to feel confident. When I say not enough data, it's not the quantity, but it's the variety. So the data, because we are serving right now, we are serving international patients as well, we definitely don't have enough data from there. So the data that we have is mainly from the US. And we are still in the process of building that data set, building that repository or our corpus to train our models. Now, when it comes to healthcare and healthcare access, there's another problem beyond the algorithmic fairness. So there's fairness at the algorithmic level, but then also fairness at the access level. So our services are not covered by insurance. So they're all cash pay. Just because insurance doesn't cover a lot of what we offer. And we feel like it needs to be a win-win for the provider as well. The providers have to be compensated for their time. They spend a lot of time to review these cases. They have to be compensated appropriately. So our services are not free and our services are not cheap. That being said, what we did, and that was really important to us against, and I'm going to say this against my advisors in the business world. We opened Top Health AI Foundation. And through the foundation, we the goal is to provide access to these second opinion consultations and to patients who cannot afford it, but also to provide these AI tools to the clinics that cannot afford them. So we have AI tools that are very powerful. And not only ours, we're partnering with other companies as well, small to medium businesses that are building health AI tools. And we are working with them to provide these tools for free to patients, if these are patients facing apps, or to clinics that cannot afford to pay for them.
Thank you on behalf of everybody, whether they have the means or not. That was my next question, because not everybody, whether in the US or the part of the world, people are struggling to especially deal with their health conditions, and not everybody is able to access a second opinion, even if it's through insurance. As you said, there are months of waiting with certain specialties that can go up to 6 months, if not more, in the US or even in other countries, whether it's Canada or UK.
Mm-hmm.
So I see through your foundation, and if I would love if you can expand on that, is you're trying to provide access or address some disparities for people that otherwise cannot have access to your AI services for review of their cases. How are you expanding? This is probably much bigger than just Top Health AI or even big, large healthcare system. And I'm trying to dance around it, but probably it's just, I'm going to go ahead and say, addressing disparities in care, addressing disparities for rural areas, for non-English speaking, for underserved population. How how are you thinking about it? I'm not assuming at this stage in your startup, are you thinking about it? Are you planning something in that regard? So how are you thinking about addressing those, if I may
Oh,
ask this
oh, we're
question?
already acting. We're all about action.
Ooh, applauding. I'm applauding.
So the first thing we are using AI for translation. So we have real-time translation during the consultation. We do translation to and from over 50 languages and dialects, and that includes Moroccan. We tested it.
Oh,
It was
nice. Nice.
so it does work really well. So we have that. So that helps, and it helps for the clinics in Florida. We're trying to serve Hispanic patients. It's helping here, and of course, it's helping with our international community or international patients. So that's on the AI side. What we are also doing, we are having an event. So, and this is again breaking news. The event
Yeah.
will be sometime in August. So what we're doing, we're partnering with a university. This is not final, so I'm not going to name the university. And we are doing a competition for most influential health AI innovations. And the companies that are selected will get to attend the event. It's going to be a Moroccan themed event with Moroccan cookies and Moroccan music. And
In. Count
yeah,
me in. I heard the food and I heard the music.
absolutely.
I'm in.
Absolutely. So there, what we will have is a number of selected businesses that will present their tools. They will each have a booth and an opportunity to demo. And then for the attendees, we are having researchers, clinicians, and then business experts so they can get the feedback from them, and also the opportunity to either provide for free these tools to clinics, community clinics that cannot afford them, or if a hospital or a group practice is interested, they can purchase the tool as well.
Now I fully understand why you had to leave something you were passionate about for over a decade. There is no way in the world a human being can juggle all these hats, but also these ambitions that I really envy you in a very positive way because you are pushing the boundaries of support, of help, of critical thinking, of a researcher, of a data scientist, and the list goes on, to be in a hub, having pilot studies, but including the community, which is really, really rare. I applaud you for that. There is nothing that could be impactful if we don't include the community to be part of it, whether it's the students being a researcher or the new data scientists that are looking into AI or the ones that have problems and need them. So you're creating a hub where the community is involved, and I'm beyond honored that you join me and you sharing all these wonderful breaking news with us here today.
Thank you. Thank you. It is my pleasure. This is not easy, and it can definitely not be done uh, through one person. So it takes a village, and it's been an honor, and it's really delightful to see everyone step up. So it's beautiful. It's heartwarming when you have the same vision and the same mission, how everyone just steps up.
Yeah, I think there is a saying which I can't remember. When you believe in what you do and you work really hard at it, people they will come. If you build it, they will come. I think there is a movie. Yes.
Yeah. I think people feel it. So when you're
Yes.
genuine, the people do feel that. And when you're not in it for the money,
Yeah.
people do see that, and they feel that as well.
And this is not something new about you. Not in my script, or I did not think about putting this in my questions. You are known in the community as a person very rigorous, that people can count on you when you're part or they're part of your project, that you care about what you work on or the people around you. So that is a quality that are you looking for that particular quality when embracing people in your team? What are the skills you're looking for from whether they're technical team, medical team, or other support team when you want them to join your mission and vision?
Absolutely. That's a great question. So having people on board or selecting people to be part of the team is extremely important. So I do spend a lot of time, and I don't want to work with people I'm not feeling okay working with. So this is something that I spend a lot of time and efforts on. And like if you do ask anybody who's working with us right now, they would tell you that it's a very positive environment. So and the way we do it, or the way I've been trying to at least do that, is to talk or to include people with similar values. So like you mentioned, people you can rely on, and when people truly believe in your mission, and they have the ethics and they have the right morals, they will turn heavens and earth to make it work. And it's beautiful what people are doing and what people are able to accomplish. So we talk about an idea in a weekly meeting, and then you see everyone sparking with the ideas, and like, oh, we can try this and we can try that, and I know this person and I know that person, and we can get it done. So it's very positive, very enthusiastic team, and it's really a pleasure to work with them every day. And also, I do hire a little bit more women than men. Uh, I think that's a bias that I have. I'm not sure that that's right, but I believe that women do deserve a chance. So a lot of women do not apply, and they shy out of the certain responsibilities and certain positions. So through this platform, I also try to empower women. So when they tell me I cannot do something, I say, okay, let's sit down, let's do it together. Let's You can. I know you can. Let's think about this and let's do it together. Because as women, uh, we lack that, and I believe that it's our duty to support each other. And I definitely try to do that through this platform.
I'm hearing the professor, the academic tone in you that is there to support the growth and empowering your progeny or your students, whether they're male or female, to make them the best that they could be. And that's all what I heard, which is wonderful. Um, Looking back, this is one of those questions where it's more reflective. Looking back, was there a moment when you realized this work wasn't just about technology, but about redefining hope and healing, especially when this entire idea or initiative started with your trip to the ER?
Absolutely. And it was actually more than one. And it was every time we started to talk to these patients through the platform, read their records, um, going through their cases and personally interacting with them. Because at this stage we can still do that. I know at some point there will be no way, but I still and I appreciate that. I appreciate that opportunity that I get to interact personally with the patients. But when I listen to the patients, also when I listen to the clinicians, I understand that it's not the technology. The technology is the means. The technology is just what gets us there. And that reminds me of the third time I went to the ER and I still had no idea what my diagnosis was. I got to triage and I started crying. And the nurse looked at me and said, your pain score right now, you disclosed a 4 out of 10. Do you want me to increase that to a 9? I said, this is not pain. It's me feeling unseen. It's nobody believing me. I am in pain. I have been in pain, but nobody's able to see it and nobody's believing me. So That's what I would like to provide to these patients. I want to help them feel seen, believed, and empowered. And to me, that's where the healing really begins.
That was truly emotional. And I think a lot of people will relate really through that last part because we're human beings. The tools, the big buzzwords are there to augment science and technology for our well-being. And AI is not new. It's been there since the 50s.
Exactly.
It is a buzzword that some unfortunately may think it's all about technology. It has never been and never will be. It's about you and I and how we make what we do with it. So I'm going to move to something quick fun before we get all teary. A quick fun one. What powers your day? Is it coffee? Is it curiosity? Or is it something else you want to share with us?
All right. So I would say curiosity starts it, but action sustains it. So it's more about the action. I feel the urge to fix things. So every time there's an idea, there's a gap, there's a pain point, it's I feel that energy to move it forward. So yeah, and of course, coffee helps. Very important.
Combination of all. Okay, I love it.
Exactly. But I believe that action truly matters. I used to think that perfection, especially going through academia, rigor, perfection, was important. But now I'm more about action. Get it done, get it out there, get it in the world. We can always perfect it. We can make it better, but let's get it out there. Let's act and act fast.
I love it. I love the coffee, curiosity, and action. And this make me think of, as I said, I spent 6 months in Morocco. I had the pleasure and honor of meeting great people in academia, in healthcare, in hospitals, in leadership. And it was beautiful. We had wonderful research talk or just coffee and or tea, a tea talk, what I call them. And one of the emerging findings from that research that we are publishing or halfway through publishing is these actionable items that you talked about, and we labeled it as operationalization of AI. AI is not just about using the latest tool and technology, but how we use it, how we act upon it, and you are a perfect example. The Top Health AI is how we put it into practice to augment, to support, to help. So what we call is the operationalization of AI. It's not implementation, is not adoption, it's not use, it's taking it to the next level. So thank you for including the coffee and curiosity into actions with the AI. Any final, I know I abused your time and I'm grateful for all the answers, the curiosity that you shared with us. And we'll wrap it up with any final thoughts that you have for me, for the audience, for the researchers, the clinicians, anybody out there that cares about health and technology, digital innovation.
I just want to reiterate what you just said, which is lovely, by the way. Like getting together around tea, that's amazing. The Moroccan tea, if you haven't tried it before, you should. But just to reiterate, it's all about listening. So if you're building AI, customizing making it into operation, then you need to listen. So we have to all listen. Listen to clinicians, listen to patients, and look at those overlooked signals in our broken system. And I believe that's how we're going to move forward.
Say any better. Dr. Lina Bouayad, thank you so much for today. Appreciate it.
Thank you so much for having me.
Disclaimer. The views and opinions expressed in this podcast are those of the presenter and do not necessarily reflect the views or positions of the organization or entity represented by the presenter.